I'm Dr. Kevin St. Clair. In the following video, we'll be discussing a common facial rash that affects many adults, middle-aged and older. It's called rosacea. Let's talk about the features and treatment of this common nuisance. Rosacea is a common condition primarily affecting the face, although rarely it can affect other areas such as the scalp, chest, or neck. What are the components of rosacea? Well, basically it's a combination of red bumps and pustules or pus bumps on a background of fluctuating redness, primarily occurring in the middle third of the face. Generally, this is a condition of adults, especially middle-aged and older adults. Caucasians seem to be more affected by this than other skin types. The redness is initially transient. It may come and go. There are factors that we'll discuss in a moment that seem to aggravate the redness, but over time the redness often becomes more persistent. Occasionally the eyes can be involved as well in a condition that's called ocular rosacea. Here we have styes, mattering, sometimes tearing or redness of the eyes that can occur in addition to the skin involvement with rosacea. Here we see a couple of typical photographs. Again, you'll notice they're middle-aged patients. It's in the middle of the face. There's background redness upon which are superimposed red bumps or pustules. Again, that redness may fluctuate over time. There are some variants of rosacea. Erythemotelangiectatic rosacea refers that the redness component, the blood vessel component, is either predominant or the only feature of rosacea. Again, this is often transient initially, but may become permanent. Some of the blood vessels are big enough that you can actually see them with the naked eye, as in the photograph on the left. Phymatous rosacea implies that there is overgrowth or hypertrophy of the connective tissue of the skin. This particularly involves the nose, in which case it's called rhinophyma. Rhino means nose. Here you can see enlargement and disfigurement of the nose, either globally or focally like we see in this photograph. This is what the famous comedian W.C. Fields suffered from, was rosacea with rhinophyma. There's another type of rosacea called granulomatous rosacea where you have red bumps, but instead of being transient, persisting for days, they can persist for weeks or months. I mentioned earlier there are several factors that people with rosacea notice may aggravate their condition, both in terms of the redness but also the red bumps and pus bumps. Probably the most common of these aggravating factors is exposure to ultraviolet light contained in sunlight. Also, wind seems to aggravate this, as well as hot or spicy foods. Alcohol or caffeine seem to aggravate this. An emotional upset often causes worsening of the redness immediately and sometimes a delayed worsening of the inflammatory papular or pustular component. Exercise or any condition such as fever, which causes increase in the body temperature, may aggravate the condition, again especially the redness. The use of topical corticosteroids, which are not intended for use on the face, may aggravate or actually cause rosacea or a condition that looks indistinguishable from rosacea. So that's one side note, is that one should never use potent topical corticosteroids on the face. Well, what else can look like rosacea? Depends on the type of rosacea. The common papulopustular type may be mimicked by acne or any of the conditions listed on this slide. You can find more information about these individual conditions here on Online Derm Clinic. The erythemotelangiectatic version, the type that's just red, may be mimicked by the following conditions as well. Probably the most common of those is seborrheic dermatitis. And lastly, the granulomatous type may be mimicked by the conditions seen listed here. Again, if you wish more information about these conditions, it's outside the scope of this condition, but please see, or outside of this discussion, but please see Online Derm Clinic for details on these conditions. Well, how do you treat rosacea? Well, first, you need to try to identify what, if any, factors seem to aggravate your rosacea. Almost everybody can benefit from the daily use of a sunscreen, because again, that's the most common aggravating factors. Detergent soaps seem to also aggravate this, so it's best to use a soap substitute to wash, such as Cetaphil, Purpose, Oilatum, Basis Sensitive, Dove. These sort of cleansers don't actually contain detergents and may be milder for people with rosacea, who tend to have drier, easily irritable skin in any case. Topical medications include some of the ingredients listed here. Probably the most common medication used initially, at least, is metronidazole, brand name of which is Metrogel or Noratate. If that is not adequate for control, or if the patient has a very inflammatory condition to start with, we may use oral medications, most commonly those that contain the anti-inflammatory antibiotic tetracycline derivatives. Isotretinoin may be used in more recalcitrant cases. For persistent redness, all that really helps clearly is laser therapy. The medications can help with inflammation, the redness, the bumps, the pus bumps, swelling, but for the true persistent redness, laser therapy is your treatment of choice there. Here we see some representations of some of the various medications that are available to treat rosacea. All of these medications are available only by prescription.